The Igbajo Achievers Lions Club has called for the inclusion of sickle cell anemia and childhood cancer treatment in Nigeria's health insurance schemes, citing the urgent need to ease the financial burden on affected families. The advocacy was made during a visit to health insurance agencies in Osogbo, the Osun State capital. Leading the delegation, the club's service chairperson, Lion Kayode Fanira, emphasized the need for comprehensive insurance coverage for children battling life-threatening illnesses, particularly cancer and sickle cell anemia. Fanira explained that while some healthcare packages currently provide limited support, they fall short of addressing the full financial and medical needs of affected children. He added that the initiative is aimed at influencing policy reform to ensure no child is left behind.
Yes, we are here today at the National Health Insurance Authority, the Shogo office, on an advocacy visit to the state coordinator and his team. And our main purpose of the visit is to advocate for the inclusion of NHIA's coverage for children living with cancer and sickle cell anemia.
Responding, the head of programs at the NHIA Oshogbo office, Agumbiade Musa, commended the advocacy efforts and reaffirmed the federal government's commitment to expanding healthcare coverage.
I would like to appreciate the Igbajo Lions Club for the wonderful initiative to, partner with the government in the face of the National Health Insurance Authority, advocating for, especially for children living with cancer and sickle cell anemia. It's a wonderful initiative. They're trying to do their best and their own part, their own quota, to ensuring that every Nigerian has access to quality healthcare service. Of course, the federal government, through the NHIA, has created different initiatives focusing on cancer patients, not just kids, adults, by partnering with the NHIA, with the Roche, that we have the NHIA Roche Foundation that caters for people living with cancer in terms of supplying drugs, giving them access to drugs at minimal amounts.
At the Osun Health Insurance Agency, the Executive Secretary, Dr. Razak Akintunde Akindele, acknowledged the concerns but pointed to financial and structural challenges in accommodating high-cost diseases like cancer. He noted that late diagnosis and expensive treatment procedures such as chemotherapy and radiotherapy further complicate coverage efforts. He also highlighted the frequent hospital visits required by sickle cell patients as a strain on the healthcare providers. Despite these challenges, Akindele stressed that prevention remains a more sustainable approach.
Preventive aspects of cancer is very important. That if our focus is not treating the cancer, if our focus is preventing cancer, we will go a long way to help so many people.
He called for the establishment of cancer screening centers and increased awareness of preventive measures, including HPV vaccination for young girls.
So if we can redirect our energy, let every state in Nigeria have a cancer screening center that they can work in. I'm a man, I want to do prostate cancer screening. I'm a woman, I want to do mammography, I want to do pap smear to check for cervical. If we can have that, we'll be able to prevent all these diseases. There were some very close people that time that we lost to cancer. And one of the problems of cancer in our society is the late detection.
I am Tosin Olasunkanmi, reporting for City Mirror News, Osogbo, Osun State, Nigeria.